Okay, welcome to Town Hall today. We're on the campus at the University of Texas Medical Branch in Galveston, and we're trying something new with a live stream and trying to provide you a live town hall. Given these difficult times that we're in, we're dealing with some new ways to try to communicate with all of our faculty and staff. We're going to honor the pledge we made earlier this year to communicate regularly so that you will know what is going on. And I know we've been under sort of a cloud of silence as people have dispersed to work from home and engage their work in different places, in isolation sometimes. We'll refine this process and learn how to use it more and more, hopefully, just like we are learning how to do our educational and other programs in different ways. So welcome today.
Our faculty and students responded to the COVID emergency in a variety of different ways. Our faculty researchers were first to identify the various ways that they can address the virus, both through testing, treatment, vaccine development. Our students were part of the teams that helped out the community with a variety of different volunteer efforts in helping support the community as they weathered this crisis, as well as our educational faculty were rapidly deployed to develop online education to allow our students to complete their academic programs. We did have to go virtual on all our commencement ceremonies this year. We wanted to do something that would give our students a sense of completion, an opportunity to celebrate, as well as having a meaningful commencement to their programs and being ready to move on to their next phase in their lives. I think in the future, health science education will really become a hybrid of what you've seen going on, where it really combines online education with experiential education. So the online pieces will deliver a lot of the foundational work, and we will teach the basics of the various sciences that they need to develop a competency in their discipline, but then we'll give them a chance to do some clinical experiences. They will have experiences working in teams, and they will have experiences working in direct patient care.
The research faculty at UTMB have really stepped up in this pandemic. They've been doing great work in both COVID and non-COVID research. Some of the highlights are as follows. We've submitted over 80 applications for COVID-related research, which estimates to be almost $37 million. We've been very fortunate. We've had over 20 proposals funded for almost $9.5 million. Another thing that I'd like to really shout out is the lab of Dr. Rick Piles. He runs a high-throughput RNA sequencing lab, and when the pandemic happened, he converted that lab over into a clinical lab that could look for and measure COVID-19 infection. Working together with Dr. Laposada in the Department of Pathology, they've been able to do a high number of tests, so much so that Galveston County leads the state of Texas in tests for COVID-19. So a great example of basic science, clinical science coming together. Our research enterprise in response to the pandemic has made several changes which have really worked very well for us. The first change that we've made is working from home. Everyone had to adapt to working from home, but our research group has really adapted very well to working at home. And in particular, I'm talking about our research services, our support people. Dr. Garcia Blanco and the basic science chairs developed a method or technique where the labs now work in shifts so that you don't have all your lab personnel in the lab at the same time. They can come in at different shifts. This has improved efficiency, and it's also improved safety so that if one member should be unfortunate to become COVID-19 positive, it wouldn't affect the entire lab. And we're going to continue these shifts as we move forward, continuing to maintain the spacing that's needed and the safety that's necessary. The number one priority for our research enterprise going forward is our continued work on the pandemic. Out of all the academic institutions across the country, UTMB is one of the best suited to actually take on this pandemic and fix it and make it go away. So we want to continue to excel and meet that challenge, not only to end this pandemic, but to prevent the future pandemics.
Once someone tests positive, if they don't require any care beyond what we can provide in the facility, they're put in medical isolation. We do our contact tracing. TDCJ has its own Department of Public Health, and so they initiate contact tracing both for the offender side, the healthcare side, and for the officer side. We identify the offender contacts. Those patients are placed in medical restriction. Once you're in medical restriction, we will provide temperature checks and symptom checks twice a day just to make sure that patients aren't developing symptoms. Those patients who are in medical isolation are seen twice a day. Those patients are given not only symptom checks and temp checks, but we also check pulse ox and a respiration rate on those. And then those patients who get sicker than that beyond what we can provide at the facility, then Dr. Ojo and his team step in and we hand off the care to them.
COVID has really impacted how we do our business, how we take care of our patients. Specifically on the outpatient setting, we've had to essentially go virtual. Essentially all our encounters are done virtually via telemedicine. We've always done telemedicine, but now even those departments and divisions who weren't really interested in telemedicine have now taken it on. On the inpatient setting, we've had to create COVID-specific units. 3 med-surg floors were reconfigured to just deal with COVID patients, and one of them is a COVID critical ICU unit.
I think it's a learning process for all of us, but certainly within corrections, given that Texas is the largest prison system in the state, I think the lessons we learn and the things that we have in place in terms of data collection will really help us lead, I think, the dialogue and the discussion going forward about what we can do differently if indeed this comes around again in the fall or some future pandemic.
UTMB Health, and we all should be proud of this, is full of fabulous, brilliant scientists and clinicians. The first thing that we did in preparation for COVID, and probably the smartest thing that we did, was to listen to them. We set up COVID units, as you can imagine. Where were these patients going to present? We made a decision to allow them to be admitted to the locations that they presented. And then once those units filled up, how did we surge? So we had to think about our surge plan. We had to think about how to staff those. We wanted to restrict who was coming into our organization, both for our staff safety as well as our patient safety. We were interviewing everybody that walked in about their symptoms. Ultimately, we took temperatures and handed out masks. People might misunderstand that we had shut down all of our clinics, but the reality is we kept most of them open, but we did restrict who could have access into those, simultaneously standing up telehealth so that we could care for and continue that patient relationship remotely and safely. We opened up Tier 1 clinics, which is a great example of asking folks that were previously doing one job to now take on a different job. And in those Tier 1 clinics, we screened thousands of patients for COVID symptoms and tested them for the COVID virus. And those ultimately became urgent care clinics for people that were positive with COVID, a place where they could go where the staff was trained and get safe and effective care. We're changing how we think about care delivery. The single biggest priority that I have, my team has, this organization has, is we've got to get UTMB Health back. We have been delaying the care for hundreds of thousands of our patients over the last 60 days. We got to get them back. Finally, I'd like to say thank you to every single person that watches this video that works at UTMB. The work that you have done over the past 60 days has been extraordinary. The perseverance through exhaustion has just been wonderful to behold and so appreciated. And the last thing I'd like to say is the optimism that you all bring to this job and this work through some of the most difficult times has kept me going personally and gives me great great encouragement for the future. So thank you all.
Thank you, Drs. Harlan, Bouton, Urban, Ojo, and Murray, for sharing your insights as to how UTMB has responded collectively to COVID-19. Everyone in this institution has had a hand in helping us care for our communities and care for each other through this pandemic. And I'm grateful to each and every one of you. In keeping with the town hall tradition, I'd like to share a few updates with you where UTMB is currently and where we're headed, both. So as we do that, the first thing you're going to see is this slide of our financial performance. Well, I'm sure that you have noted, as I have, there's only a few green dots and lots of red dots. Does that surprise you at this moment in time? As with all academic medical centers and hospitals, and just about every other organization that's dealing with healthcare and healthcare industry, we have been significantly impacted by the COVID-19 pandemic. The bottom line is, you can see on the screen, UTMB finds itself in challenging times with regards to the 2020 budget, around $44 million off where we expected to be at this time at the end of April. I would love to be able to tell you not to worry about that, but you and I both would realize that's not true. In UTMB fashion, we're all working together to do everything that we can to face this challenge head on. For example, we've implemented an 8-for-8 vacation program for all UTMB employees. The 8-in-8 plan is a cost savings measure that we put in place earlier this year to help us avoid layoffs. I hope that met with your approval, and if possible, we want to minimize layoffs in the future if they should become necessary. We can do that by making wise financial decisions now. It allows us to clear some financial liabilities that are on our books while keeping salaries whole for you and other employees who are able to use leave and leave accruals for those 8 days. 8-in-8 is only one of several measures that we're taking to help manage our financial health in this unprecedented time. Among the other measures you've probably heard about, we imposed a hiring freeze with a very limited number of exceptions to that. That means all new positions for the future were frozen with the exception of critical faculty and educational and our research recruits. We have also had the ability to continue to recruit in our clinical enterprise for our key jobs that simply must be filled. Freezes were also imposed on reclassifications and related salary increases. I know that is troublesome for many of you, but I would simply ask for your patience until we see a break in the clouds and better days financially. Suspending payments for our at-risk incentive programs was not a popular thing to do, but none of us had a better choice in mind. Executives and others who were receiving at-risk incentive payments for the year 2020 were simply canceled. Increasing our marketing efforts is another thing that we have done to reassure patients that it's safe to return for medical care and make appointments at UTMB. Well, hold on, some of you may say. Why would you spend money on marketing when we're having problems with salaries and payments and things like that? Well, in order to stay in business, we simply have to get the word out in a big way to demonstrate that we are open for business and that our hospital is safe to be a patient therein. We have also established the COVID Operations Fund. The COVID Operations Fund has about $76,000 in it so far. Do you remember how much I said that our shortfall was at the end of April? 44 million? $76,000 not going to dig us out of that hole. I'd really, really prevail on each of you to think carefully just how much you might be able to contribute above and beyond what you've already contributed. I know one of our very generous faculty members added $25,000 to that fund recently, or we wouldn't have the 76 that's currently in it. So think about what you can do to add to that fund so that sharper measures will not be needed in the future. Let's take a few minutes also to discuss our priorities for the remainder of this year. Well, as you might have guessed, we have to maintain a rigorous response to COVID-19 to keep our employees and our communities safe. Well, how about community and employee safety? We have been one of the top places in Texas to do testing and take that testing and translate it into meaningful action within our communities. Did you know that we rank #1 in the state of tests done for COVID compared to all other counties in the state of Texas? Do you know we're doing testing for the Texas Medical Center and testing also for counties throughout Texas? We've done testing for almost every nursing home in this county. We're proud of the response that we have been able to muster for that part of the COVID puzzle. And that would not have happened at all had we not had laboratories working together. And I really understand more than any other time now the real meaning of working together to work wonders. The clinical laboratory located in the hospital enterprise worked with the Galveston National Lab from the research and educational enterprise to create a synergy that we have never seen on this campus before. They last week did the 60,000th test of COVID testing. That's a huge record and something we should be proud of. They have worked around the clock to provide for us a safer environment on this campus and a safer environment in the community. As a matter of fact, when we check the testing of our own employees, we've discovered that it's actually one of the safest places is on this campus. We have less COVID positive people on this campus, including patients, than we do in the general community outside of this campus. We also are working hard to successfully return our clinical and hospital operations to their capacity. And that capacity gets bigger every day. The Clear Lake campus is already reporting exceptional results since it opened just about 10 days ago. And not only is it making huge strides forward, the League City campus hospital opened an additional 60 beds last week, and it's my anticipation that those will fill up very soon. Not only did it open 5 weeks earlier and truly under budget for what was allowed in that budget for our building. We have several things to celebrate today, and certainly the people involved with that on Dr. Harlan's team, Katrina and Lambert and all of her co-workers did a monumental job in finishing that hospital up so that we can add even more patients. Our priorities for the rest of the year also include a desire to serve as an international leader not only in COVID-19 work, but in other infectious diseases and in other critical areas of scientific investigation. It's really thrilling to see the number of papers going in for grant applications that our faculty have authored over the last several weeks and months. It's truly astounding that the papers not only just go in and get looked at, but they come back with approvals on them. Is that not right, Dr. Urban? You can shake your head back there. Thank you. Yes, they come back approved, and to date, I wanted you to do a shout out. How much money has come in for COVID or related research? almost $10 million. And that's not from the philanthropic community. Those are from federal agencies granting work here on our campus. That's a record amount of money in a record-breaking time. We're proud of those scientists who are doing such an extraordinary job under the gun to find a cure and relief point for COVID-19. Closely and carefully monitoring expenditures through this summer and pursuing new business opportunities are also key to our success in the rest of this year. And some of you would probably be puzzled and say, well, what kind of new business opportunities could come along at this time? Well, there are all sorts of things that have sprung up during the COVID months. One of those is certainly telemedicine, and we are just putting the approval on a contract with Princess Cruise Lines to provide telemedicine services to 96 of their ships. Now, not all 96 of them come to Galveston, but they'll use telemedicine services for consultations worldwide. Some of them do come to Galveston, and for those that do come to Galveston, we'll be extending to their crew and passengers, if needed, healthcare services at our own UTMB hospitals. So those are good things that have come of this. Also, all those testing that I was talking about, that lends itself really well in the current conditions to an opportunity for testing over the next several months. We are currently doing testing for many hospitals and healthcare facilities in the Texas Medical Center area. We're also doing testing throughout the state of Texas at the public's demand, in other words, the state's command, and at the governor's request. We're also working synergistically to take the specimens that others collect and send to Galveston to do those tests and return again in record-breaking time those results to the local health authorities. So those all become viable lines of business for us. And it's another occasion where the laboratory has worked very carefully with finance to come up with pricing points that are realistic, are a service to the community, and at the same time afford an opportunity for UTMB to add to its margin. We also are marketing our services in key market areas. There are new health services that we have perfected during this period of suspended animation that are being brought out to the general public in the Clear Lake area and the local area. Well, what are we doing to really increase the economic impact of those clinical services? Many of you have learned by now that the busier we are in the clinical area, the more revenue comes into UTMB, which in turn is the fuel for the academic and research enterprise and for the educational mission that we foster. UTMB has done a lot in the last few weeks to increase our clinical services across our region. We've implemented an ongoing multi-channel marketing program with communications that include print advertisement in local and regional media, targeted emails and print correspondence to our patients, and enhanced publication of expertise in the local media. We have for years had at our disposal MyChart. This is the first occasion that I can recall, Becky, that we have actually used MyChart as a marketing tool. Our physicians in our community-based clinics made videos and sent videos through MyChart to their patients, which was not only just a stay connected, but a popular form of marketing, particularly in the primary care arena. We have also emailed individuals, and if I recall correctly, this week we sent out, Steve, 125,000 mail pieces directly into people's homes. So I'm proud about that. I mean, that's a good move, and again, ladies and gentlemen, it takes money to do that, but if we don't do that, what is the alternative? Well, the alternative, you really don't want me to talk about that. I'll leave it at that. We have also enhanced our publication of expertise in local media in ways that we have not done before. We have taken control of our marketing campaigns ourselves and are doing that in-house. You will see a lot of ads featuring our scientists, our clinical providers, our personnel here at UTMB. UTMB is our people. We are a group, we are a family, and we want to get that message across. Our family cares about each other, and our family cares about your family. That message must be heard by all the people who listen to us. Physician videos are speaking directly to patients, and with our callback of people regarding their surgery that's been put off, many of our doctors join that callback pool and call patients themselves and to say, I'm sorry we've had to interrupt your care, but I think now is a safe and appropriate time to resume that. Well, how successful has that program been? Dr. Harlan shared with me this morning that that program has been successful enough to result in us getting 75% of our ambulatory visits back. It's been successful enough in the Clear Lake area to record the best month in the history of the operation of the hospital since it opened under UTMB's directorship. There's significant social media engagement also occurring at this time, thanks to many of you. And we have been trying to highlight UTMB's heroes. You know, a very moving thing just occurred. Sometimes they occur by happenstance, and that was this case. When I went over to watch the first of our 51-day patients leave the hospital, the parade that ensued after that, I walked back through the above-ground parking lot and saw a little lady who looked a bit lost, and I asked her, could I help her? And she was looking for a car. Fortunately, we were not far away. We were actually standing right beside it. But I had lots of help in doing that. And I asked her what brought her out that day, and she said, I'm taking my baby home. And somewhat elderly lady, I was curious, so the next question was, well, where's your baby? And she said, he's in that ambulance there, and we're getting to take him home. I never thought I would see this day. Thank you, UTMB. That's a real story. Those are real people. You've made a difference in their lives. His picture was on the front page of today's paper in the Galveston County Daily News. It was there because he was just completing his rehab, and his family has learned how to take care of him at home now. So that's a victory story. There's dozens upon dozens of those coming out of our hospital. We have heroes that work among us. And I hope you picked up your T-shirt that says Heroes Work Here. How about the return to campus? We began slowly a few weeks ago bringing employees back who've been working from home. We bring them back to campus based on the needs of the individual mission area in which they work. There are certain roles and performances here. Nurses, the most obvious, are needed to work in clinics in the hospital. There are other jobs that require people to sit at a desk, answer the phone, process information, complete forms, all sorts of things that have to be done in a certain environment. We are also fortunate there are many jobs in which work can be done from the home workplace. So we are carefully trying to assess the needs that supervisors have throughout the enterprise to match people with the best workplace. And some people may match a little bit in both. The job that they hold may require them to be here on campus for 2 days a week and at home for 3 days a week, or some number like that. We are confident, first of all, that it's safe to return to UTMB's workplace. As I've already told you, the data we have shows that our campus is one of the safest places to be in Galveston County. As the virus's rate of spread is measured every single day, we're taking steps to, even as things cool off, continue to measuring the virus's prevalence in our community. We have received 2 generous grants, one through what's called CDBG funds from the city of Galveston, in which they are supporting to the tune of $300,000 the process of continuous testing on Galveston Island. And we have also, unless federal funding becomes available for this, have received a pledge of another $300,000 for the same purpose for use here on Galveston Island. What does that assure us? It assures us of the ability to keep a temperature eye or a barometric eye, however you would put it, on the spread of disease here on the island. And in turn, that allows us to determine how safe it is to continue our operations. So we will be screening people in the general public. We'll be screening people in our own workforce. We'll take whatever step is necessary to keep our people safe at work and in the community. Managers have received instructions, are preparing a list of staff who are being brought back to campus. Those are ones who are needed here for specific jobs on campus. Others will continue to work from home, and you'll get more information as we move along with that process. There'll be people in human resources available to answer your questions regarding telecommuting. Your manager should simply contact your human resources benefits partner, and they will be able to supply the information that is needed there. We will still use, to some degree, telecommuting. So I could envision at least 25% of our workforce continuing to work from home in the near future. And that may not be just near future. There may be certain jobs that lend themselves so well to working from home that we continue that over a longer process. There are some areas that need people on campus, so if your manager chooses you to work on campus, please don't think it's a personal vendetta or a payback of some sort. They simply have chosen you to work in a special place. If it's at home, same is true. If you vacate your workplace here, we can actually take it offline. There'll be no reason for heating and cooling that workplace after we restructure things, and there will be no need for janitorial services. There'll be no need for electricity. Think of all the savings we could have if we had 25% of our workforce working from home rather than here on campus. Mr. LeBlanc is already looking into the potential of moving people from where they are right now into other places. And you say, well, I need my specific workplace. I need my desk and my stuff. Well, life may not be that way in the future. You may share a desk with somebody else, and I mean that they come in on Monday and Tuesday and use it on Thursday and Friday. Same desk. The only difference would be one of those little Clorox wipe bottles on it, and the last person there cleans off the desktop. And you brush off the keyboard when you come in and put on your gel and get to work. So work may look a little different than it did when you left. And that's not all bad. There's some positives to that. Please try to frame it that way. I know it's hard to do that. You know, we all live in a very possessive, don't mess with my stuff world. And, you know, even if I only worked one day a week, many of us would want my own desk and my own place. But the world has changed, and that just isn't possible all the time now, particularly when you have to pay the rent and the light bill. That said, I'm sure I'll hear a lot about that later. Not only did he take our vacation days, he took our desk too. But that's life in COVID times, ladies and gentlemen. We're flying in a different plane, and we want to get you there safe and with a job if at all possible. But it's going to take you helping us do that. The overall needs of every department are going to be considered in this process. There'll be no absolutes in the term of everybody will have an opportunity to discuss the changes in their environment. I want just a little closer look at telecommuting. Steve LeBlanc coined the phrase, a new normal, and that has moved itself into a task force to take a look at telecommuting options for UTMB on a permanent basis. That task force, that task force represents people across the entire UTMB enterprise, and that includes the President's Office, institutional support, human resources, information services, the business and facilities, finance, the health system, and the academic enterprise itself, and included in that, of course, is the research enterprise. Research has already done some incredible changes. I just need to give them a shout out. In order to keep to the don't crowd me out rule of too many people being in a small space, research has already implemented shifts for research workers and graduate students. Some come in for, I'll call it an AM shift, and some a PM shift. So the laboratory gets a lot of usage. There's even a thought, at least of mine, that addresses some space issues, but there's only so much equipment you can get into those labs, our people. So we're going to put on our wish list some revisions in the future if the legislature is generous enough for some tuition revenue bonds in the future. We're going to direct a lot of those bond monies to major renovations in our research enterprise to assure that equipment is modern and working. We learned a few lessons here, Dr. Urban, when we were gearing up for COVID, that we had a lot of equipment sitting around that didn't work. And we really hadn't taken the time to take as good a care of it as we should have. So we need to go back and take a look at where to make some strategic investments in this enterprise. Fortunately, our clinical enterprise had been invested in because we have a lot of new hospital space and it got new equipment. But there's always more that one can do. We'll look at the long-term adoption of telemedicine, telecommuting rules, and hopefully our employees will all have a hand at putting their fingerprints on those documents and helping build the world that they will work in to come. I want to also just take a moment to talk about the word resilience. What is the key to resilience? Well, some, as a former, well, I guess you're never a former Boy Scout, you're always one, aren't you, and an Eagle Scout. Dr. Mouton agrees with me. The best you can do to be resilient is to be prepared to begin with. And I don't know how an institution could be more prepared than UTMB for a pandemic. We are home to the research that has been extraordinary in infectious disease work. We have a biosafety level 4 care unit on our campus. We have people well trained in how to don and doff personal protective equipment. We wrote the book on many of those things. And so we know from previous experience, and for years, we have been dealing with storms and fires and now a pandemic. And we have performed in a remarkable way. When we started our Incident Command Center and people came together and joined us virtually, we were able to stand things up in a remarkably fast manner, effectively, to meet the demands that we weren't even sure what the demands were half the time. We just knew that something was coming and it wasn't going to be good. We did all that in a matter of days. And we have to have the same preparation and resilience going into another phase of our regular life at UTMB. And that's preparation for a real storm called weather. We have predictions that we are likely to have some incredible storms this season that find their way over into the Gulf of Mexico. The last several sessions we have rolled out storm preparation. We have done a lot of preparation, but most of the storms have been on the East Coast, and we were very fortunate. This year, it looks like more of those storms are going to find their way into the Gulf. There's a new one even today in the Gulf. So I just urge you to pay attention. We will transition our Incident Command Center into also a Hurricane Center. Well, I've focused on a lot of bad things, haven't I? Speakers bureaus say you should always end with at least one or two good ones. So I've got more than two, but I want to at least give you some hope for the future. By the way, I don't have a twitch. I keep doing this and looking over. Most of the people are sitting right over there who are in this auditorium. So if you think I've got a new neurological disease, please don't call Dr. Bodwash yet, okay? We opened our new South Tower in League City this month. As I said, under budget and under time, 60 rooms. That means the hospital's total is 97. For some of you old-timers who've been here since the earth cooled, would you have ever thought that UTMB would have had a 97-bed hospital on the mainland in League City? Ask the people in League City. They would have never thought that. They wished for it for years. 97 beds with excellent staff. And within the walls of that hospital are some of the most extraordinary people I've ever met. And I finally know why, because I've asked them. Many of them went to nursing school here or medical school here, and they loved UTMB so much they came back to work there. That's one of the highest compliments this school can ever get. Today I attended an awarding of special recognition to some of our outstanding residents and fellows. Dr. Mouton, I was just overwhelmed at how many of those young men and women actually went to medical school here. They are staying here for further training, and a couple of them are staying here to be your faculty members. It is extraordinary the high quality we are seeing in the people who are filling those hospital walls. The new tower is going to be a landmark area for us because you know what? We can add another 60 beds on top of that, and I believe another 60 on top of that. So we are going to be successful there for quite a while, I hope. The project was completed, and we have opportunity now to fill it up, so we really want to do that. We have 30 acuity adaptable or ICU type beds and 30 med-surg beds. We have a pharmacy, blood bank, lab, sterile processing, dining, kitchen, departments within the lower part of the hospital itself. We also have respiratory therapy, clinical transportation, environmental services, linen, volunteer services, medication, and a chaplaincy program. It's an extraordinary chaplaincy program, by the way. All of our programs are linked together. So some good news there in getting that off and running. There's more good news over in the academic enterprise. They responded quickly and quite effectively to the pandemic by standing up literally over a weekend all of our clinic ambulatory visits. And I went to telemedicine in a short period of time, like 48 hours, thanks to a lot of help from infrastructure and staffing individuals. And we're seeing on an average of 2,000 to 3,000 patients by telemedicine and 1,000 face-to-face, and always at least 100 in the COVID clinics every single day. That is a monumental feat of work that should be written down in history books of this institution to be memorialized. They also, in the academic enterprise, have assured that our graduates have celebrated graduation on time with the degree they signed up to get, nothing short or diluted down. They have completed and found clinical rotations for those that were lacking. It's another session in which you see people working together to accomplish a common goal. We had some respiratory therapy students that needed additional clinical hours, and Dr. Harlan found them positions in the Jeannie Seeley Hospital and other places in order for them to complete their hours required for certification. So we have people working together to work those kinds of wonders. That's not only moving and wonderful to describe, it's what UTMB is best known about. Or best known for. In May the 15th, the School of Nursing recognized its graduates. I'm sorry, that's the School of Biomedical Sciences. And later, a week later, on May 21, the School of Nursing recognized its. And the School of Medicine will hold its virtual commencement on May 30th. The School of Health Professions and Physician Assistant Studies will make their graduation at the end of August this year. A lot of times I hear UTMB just doesn't get the media coverage that it should. Well, Galveston Island has only one newspaper, so if you're counting articles written, there's only about 365 opportunities, I'd say. So how many media, if you did a media search today, how many news articles would you think you'd find out there on the internet? Would you believe 3,729 that cover UTMB's management of COVID, new articles published in scientific journals? Since the onset of the pandemic, there have been numerous articles in the New York Times, the Washington Post, on CNN, all the major networks, NPR, and others. It's amazing driving to work on NPR day after day. I can hear a UTMB faculty member talking about the latest research findings regarding COVID. And if you have time in your day to read the articles, you can find them too. Also really proud of our philanthropic support. If you didn't ever feel loved, you should now. UTMB and UTMB hospitals have received over 5,000 meal and snack donations that total over $45,000 and $21,700 in supplies, including everything from coveralls and gloves, face shields, towels, buckets, and sanitizer wipes. Seeley and Smith Foundation didn't want to be outdone by that, of course, so they handed us a check for $3.3 million focused on COVID research and funding for different laboratories here on campus, and also funded $1.3 million over to redo the St. Vincent's House. St. Vincent's House we could not see patients in because of social distancing and lack of equipment. So they are paying to have the entire place redone top to bottom. And that has been a huge investment of time and supplies for our students. We also had another $1 million donated from Seeley and Smith. So that's close to $5 million from them, going primarily to research, but also to some community causes. The Moody Foundation has also chipped in for over $3 million. $2 million of that is a new chair for the head of neurosurgery, and also a couple of different research projects, one from their Moody Medical Research Institute, which is a first distribution from that fund for us. We're very, very happy for the people who've received that and made such excellent proposals. Yes, I am ready to close. We look back so far this year, we can be proud of a lot of things that we prepared well for. First of all, the commitment to education in our students and the conferring of degrees to the future of our health care has been conducted in a professional, caring, and extraordinary compassionate manner. Dr. Mouton, congratulations to you, to our deans and all their staff for a job not just well done, but a job that exceeds expectations. Also, our research enterprise has been more active, innovative, and groundbreaking than any time in its history, including that of even Ebola. Yet we find ourselves building every day on what was learned in Ebola and Zika and all of those other opportunities to learn and build on the scientific discoveries of those before us. Thank you, Dr. Urban, and the leadership in the School of Medicine, the basic science chairs, for the extraordinary job that you have done in leading attack on a disease that's killed almost 100,000 Americans and disrupted the entire world economy. Thank you for what you are doing and for the success that you will meet. And lastly, to our healthcare providers, I really stand in awe of the job that you have done. I have walked through the hospital and I've walked through the TDCJ hospital and seen the patients lined up awaiting your attention. Our patient care providers have been better than ever, providing care to our communities, going out and screening people who were wondering if they had COVID, and some found they didn't, others found they did. In this unprecedented time, you have been, we would usually say, the healing touch, but in this occasion, you've been more the voice of comfort and the voice that brings healing to the bedside. I'm proud of each and every one of you. I am proud of the difference you've made in people's lives. I am proud to be a part of UTMB. I'm one of those graduates who went to school here and just didn't go away. I'm sort of like your bad penny. We're not going to give up till COVID is behind us and we're on stable financial grounds. We're not going to give up until each person that comes to our door is met with a warm embrace and a welcome back home to UTMB Health. I'd like to invite Tilly Clark now. Tilly is the UTMB Employee Advisory Council liaison. She's also head of the UT System Committee on Employee Advisors. Tilly is going to bring forward some of the questions from our people who tuned in, our members of our staff who just have that they want to terrorize me with.
Thank you, Dr. Raimer. We have a question from our health system. With our patient census picking back up, how do we as a system plan on having the bedside nursing staff take the amount of time off required by the 8 and 8 plan? This is a problem as we have been working short-staffed according to the staffing grids for months, even before COVID-19. Did we make the financial challenge worse by shutting down too many units without there being a surge?
Well, if we made the financial worse, what you would be looking at is a lot of your colleagues who didn't have a job right now. So that would be my blunt and honest answer. But I'll give you a real answer. The real answer is we know that's real difficult. We understand that. We discuss that. But it's the only way to deal with the massive shortfall that we're facing. If we don't deal with that, the next step is, just as I've said, another step that none of us want to take readily at this point. So what we have done is your manager should be making every effort possible to pull in people from other places, the float pool, this, that, and the other, to cover you when you're away. We want your time away to be a time of personal renewal and rest. We don't want you worrying about your job or your patient. And to be sure that that happens, Dr. Harlan and his management team have assured me that your time away will be covered adequately to not leave a burden on your coworkers. Please let me know if that is not happening, and I will have a conversation with the people in charge. Thank you.
We are currently on emergency status and have been for several months. We have also now been mandated to take vacation. For the nursing staff, on these mandated days, nurses are being told that the vacation can be reversed at any time for staffing needs. I think we need clear direction about why we are expected to be able throughout our vacation day, yet we are not getting on-call pay.
I am, again, sympathetic to what you're saying about, but I will tell you that I will need time to look into that. I have been told quite honestly that if it counts as the day that you're taking, you're instructed not to have your phone on and that you're instructed not to do any meaningful work during that period of time. So that's what I've been told. I don't understand why you weren't told the same thing. So we'll get to the bottom of that and we'll get a clear answer to you. Thank you for the question.
Governor Abbott on 7th said, "The most important element of Phase 1 is protecting our most vulnerable in Texas. Does UT System and UTMB plan to identify high-risk and vulnerable populations to balance remote work and support resources identified as standard practice by WHO, CDC, and local authorities?"
UTMB has almost 14,000 people across the state in a variety of roles and work environments. What we're going to do is simply do our best to balance remote work and support resources as identified by practice standards in WHO, CDC, and local authorities. As we do that, we're going to need to make individual assessments of each of those jobs. They may look alike and have similar job descriptions, but they may be variations or differences within those jobs for which there should be certain accommodations made. We will address those on a person-by-person and job-by-job basis to determine what needs to be done for the employee and for UTMB to succeed in their relationship with each other.
Dr. Raimer, on behalf of the UTMB employees, I'd like to thank you for your leadership and your dedication to the health and safety of our patients, our students, our faculty and staff, and our community. Thank you.
Thank you, Tilly. I do appreciate how you represent all of our employees in such a wonderful way at the UT system level. I think this is an appropriate place to announce this. I have just appointed Tilly for another time of service on the Employee Advisory Council.
Thank you, sir.
Thank you, Tilly. Thank all of you for tuning in today and listening to us. Give us your feedback on how this filled or did not fill your needs. I'm sorry if I don't have all answers to every question right now, but if you filter those over to our office, we will do our dead level best to get you a prompt reply. Thank you. Have a good day.
UTMB Health, working together to work wonders.